Hello, everyone, and welcome to the latest social media live event hosted by the National Cancer Institute. My name is Dr. Doug Lowy, and I am the acting director of NCI. Today, as we anticipate celebrating Juneteenth this coming Sunday, we wanted to take the time to talk about the importance of diversity and equity in the scientific and healthcare workforces. Having a workforce that reflects the American people and that is equitable in its treatment of all people not only helps the workforce itself, but the people who depend on it. We look forward to discussing this important topic with you more today. Now, I want to give each of our panelists the chance to introduce themselves. Let's start with Dr. Gray.
Hi, I'm Dr. Paulette Gray, Director of the Division of Extramural Activities at the National Cancer Institute.
Thank you. And now, Dr. Hall.
Good afternoon, everyone. My name is Jeffrey Hall. I am the Deputy Director of the Office of Minority Health and Health Equity here at the Centers for Disease Control and Prevention.
Thank you. And Dr. Jones.
Hello, everyone. My name is Dr. Randy Jones. I'm a professor and associate dean for partner development and engagement at the University of Virginia School of Nursing and the assistant director for community outreach and engagement at the University of Virginia Comprehensive Cancer Center. And I'm representing the Oncology Nursing Society.
Thank you. Throughout the broadcast, we will provide links to resources in the comments section and encourage you to participate by adding your comments during the discussion. Because this event is recorded, we won't be able to respond to questions right away, but we'll get back to you as soon as we can after the event has concluded. Dr. Gray, would you like to get us started with our first topic?
Yes, and thank you, Doug. Dr. Lowy. Our first question for today is, what do we mean when we talk about equity in the healthcare and scientific workforce? First, I will start with Jeffrey. Jeff.
All right. Thank you, Dr. Gray. So as we might all imagine, equity actually has many definitions. One, from the strategic plan to advance DEIA in the federal workforce that was released by the White House last year, describes equity as the consistent and systematic, fair, just, and impartial treatment of all individuals, including individuals who belong to underserved communities that have been denied such treatment. Equity in the healthcare and scientific workforces thus involves active practices and policy implementations, ensuring fairness and impartiality in areas such as professional pipeline cultivation, recruitment, and hiring, as well as in staff deployment or management, in staff development, and last but not least, in staff promotion.
Randy?
Yes. When we speak about equity in the healthcare and scientific workforce, we're really kind of also saying that, each individual working in the healthcare and in the scientific community have the same opportunities to work to their fullest scope of their practice and have the ability to be promoted and advanced in their profession without barriers due to social or systematic challenges such as child care challenges, institutional racism, sexual identity, disabilities, and so forth.
Okay, thank all of you. Now, a second question for you. Why is equity in the healthcare workforce important for patients? How can it improve care? I will go first to Randy.
Thank you. So increasing the diversity and equity in the workforce will also help just to improve the creative thought and innovation that is more representative of diverse communities that we serve as healthcare providers and investigators. It has also been noted that healthcare providers who identify within underrepresented groups, such as African Americans, Hispanics, or Latinx individuals, and also Native Americans and other groups, are more likely to practice in underserved and rural areas. Racial and ethnic diversity in the workforce can help patients who have been historically marginalized become more active in seeking care and also receiving care that may be more helpful for them, and also continue to have a better relationship with the healthcare system. In addition, a diverse workforce can really bring forth different perspectives and experiences that really help identify, implement those interventions, particularly in such a complex healthcare system.
Thanks, Randy. Jeff?
Yeah, thank you for the opportunity to also provide comment. One additional element that I'll add to the conversation is that when we progressively move towards achieving workforce diversity and equity, one thing that happens is that we become progressively more able to really ensure that with the objectives that we set for what we do, with the design of our programs and with the implementation of our services, that all those things will happen in ways that really will be both responsive to and also resonate with the specific needs, circumstances, and priorities of those different population subsegments and groups that we serve. What this also potentially means is that the way we provide care, the way that we deliver services is really going to more effectively account for things such as the economic, environmental, social, as well as political conditions that shape health. This is really critically important because these specific types of conditions are those which can create health inequities. They can create differences in risk exposure. They are responsible for differences in social vulnerability. And most unfortunately, they are sources of major gaps in health or health disparities. So we believe that as we pursue increased diversity and equity, we position ourselves better to be able to do better with the service that we offer on behalf of those that we support and that we serve.
Thank you. Doug?
Well, I'd like to emphasize two aspects. First, as has already been said, that the perspectives of people with different backgrounds are going to be different, and together they can make better solutions for patients. But the second reason is that it's very important for patients not necessarily to be taken care of by someone who looks just like them, but within the healthcare system, when they are going to that system, to see people like them, because it's critically important for there to be trust and confidence that patients have in their providers, and seeing people like them and people with whom it's easier for them to associate and identify is going to make the healthcare experience that much better, and we think, better outcomes for everyone.
Okay, so based on your three responses to that question, I'm going to give you another question that's not on your list. It is no secret that structural racism and discrimination has caused a deep-rooted distrust between people of color and the medical research community, which is why equity in the workplace force is not only important to the researchers, but it can also prove to be life-saving for patients. What are your thoughts about those the comment that I've just made? Doug?
Yep, Paulette, to me, this really has to do with trying to build trust and confidence on the part of patients in their healthcare providers. And it's absolutely critical for making the outcomes to be positive, and as you point out, potentially life-saving.
Okay, Randy?
Yes, on similar same lines, we must be honest with the community and ask the community really what are their health priorities and their health needs, so that clinicians and investigators, we can be able to be aware of some of these items and be able to address them as closely as possible.
Jeff?
So I agree with both the previous panelists. I do think too one thing that's vitally important is to view mistrust and distrust from a very specific position. A lot of times when we think about um, those two things, people assume that the mistrust or the distrust and even some of the misinformation that we have to really contend with currently, that they're really completely irrational. But if you take a look at some of the social and historical backdrops within which some of that mistrust, some of the distrust, and some of the misinformation has originated, there are some elements of real social experiences that get carried forward, into patient and doctor and clinical interactions that happen currently. So we really have to be able to speak directly to some of the real sources of the basis for breaks in relationship that we can see be present sometime, and together with patients and with populations figure out ways into the future that will not discount some of the ways that they feel about things, but really create new openings to strengthen relationships based on facts and based on new possibilities for positive health outcomes moving forward.
Wow, thanks to the three of you.
May,
Finally, we want
Paulette, may
yes.
I, I should have added that respect for all patients is absolutely critical. And I think what Dr. Jones is talking about is really predicated on there being the appropriate respect for all patients.
And Doug, we agree with you 100%. Finally, we wanted to take a few minutes to talk about what each of our organizations is doing to advance equity in the workforces we serve. Doug, would you like to start by discussing what we're doing at the NCI?
Yeah, thanks, Paulette. Uh, I would like to first talk about what is being done at the level of NIH, because NIH has made a deep commitment for advancing equity, both for healthcare providers as well as in the research workforce. And it is a group that's called Unite, and there are multiple activities that are going on without that. I'm sorry, that are going on within that. And NCI has a complementary set of activities that is has oversight by the Equity Council and a number of working groups that are making numerous efforts to strengthen the workforce by having much greater representation by underrepresented groups, both at the area where they're conducting research, but also at the level of research training. And then, in addition, both at the level of NIH as well as NCI, of trying to improve the equity within the healthcare distribution network, what healthcare providers, so that they will look more like the people that we are serving.
Very good. Thank you, Doug. And I might add that NCI and NIH are working closely, as are the other ICs, to improve the diversity of the workforce within the NIH, but also to begin taking necessary steps toward achieving the larger goal that has been established for all of us. Okay, so on that note, I will now move to Jeff.
All right. Thank you, Dr. Gray. CDC has a number of programs that are potentially relevant for our discussion. If you'll allow me, I'll speak to two specifically that are most directly associated with my office. This is a chance to kind of talk to your own backyard just a little bit. So very quickly, one program that I'm going to mention is focused on undergraduate development, and the other is focused on graduate level work. Both are pipeline development programs. The first is the CDC Undergraduate Public Health Scholars Program. And this particular program is an 8 to 10 week summer internship, which really has the intent of exposing undergraduate students who are interested in either biomedical sciences, healthcare, or public health with access to different experiences where their career aspirations are concerned. This particular program has the goal of really stimulating and increasing students' interest in health equity as well as in public health. And it's also really intended to encourage their pursuit of advanced degrees as well as careers in public health and numerous other healthcare related fields, including the biomedical sciences. So again, ultimately, the goal of this particular program, the CDC Undergraduate Public Health Scholars Program, is to increase the number of persons from underrepresented population groups within these particular fields. The second program that I wish to mention is the Dr. James A. Ferguson Emerging Infectious Diseases Fellowship, or we refer to it affectionately as the Ferguson Fellowship. This is a 9-week summer program that provides research-based educational and professional development experiences for graduate level scholars who have expressed interests in infectious diseases, public health, mental health, maternal and child health, or a variety of other areas where health disparities research can be an emphasis of their time in this particular program. So these are two specific pipeline programs that our office here at CDC has connected with it at this particular point. Again, the Ferguson Fellowship shares with the CDC Undergraduate Public Health Scholars Program the aim of promoting diversity among future public health and biomedical science researchers and leaders.
Thank you. Randy.
Yes, the Oncology Nursing Society is greatly aware of the inequities in the healthcare workforce and are putting things in place to really decrease the gap in the workforce related to race and ethnicity. It is the position of the Oncology Nursing Society that all persons will have access to equitable and comprehensive affordable healthcare without discrimination, including populations such as at risk or vulnerable and those underserved populations. Also thinking that evidence-based continuation of educational programs and clinical practice guidelines, they'll be available to oncology nurses to really ensure that a well-prepared oncology nursing workforce will be equipped with all the time and the ability and the needs of people at risk for living with cancer, as well as the oncology nursing workforce will be really diverse as the people in the communities in which they serve, by really looking at how do we be able to start at an earlier stage and letting individuals understand what is nursing, what is oncology nursing, and what's the impact in holistic care of nursing to the patients, as well as the Oncology Nursing Society is really looking at the holistic cultural sensitivity and also quality of care, cancer care, that requires equitable access to healthcare professionals via be that telehealth or in-person visits, and having a better understanding of how cancer will actually affect how people are well. For example, the Oncology Nursing Society, within one of their premier journals that they publish, being the Oncology Nursing Forum, me and myself and some others, we have been charged by the ONS, or Oncology Nursing Society, to write manuscripts and to really think about what is the update for oncology nursing research agenda. And some of those things that came out of that and looking at the priorities and recommendations for future oncology nursing research in the workforce is really looking at how to be able to allow deans and directors of schools of nursing to be more active in the recruitment and retain and support of faculty and students of color, by really providing an inclusive environment for learning and being able to address the needs of those individuals that are underserved and the individuals that we actually care for within our healthcare system. And also thinking too within the how to help nurse managers be able to provide the support to nurses of color or from underrepresented backgrounds to really move up the clinical ladder, and which also increases the retention and diversity within the workforce.
Okay, Doug.
I think I already addressed this question.
I think you did, but that leaves an opening for me to pose another question to you. We hear fair amount of the importance and value of patients, and you've shared that with us today. And having providers who look like them or who share their background. But what about researchers? Why is diversity of the research workforce, especially non clinical researchers, important? Doug?
Well, Paulette, there actually is a fair amount of evidence indicating that if you have people from diverse backgrounds and points of view, the quality of the output of the research will actually be better. And Marie Bernard, who is the Chief Officer for Scientific Workforce Diversity at NIH, what she likes to say is great minds think differently, rather than what we usually hear is great minds think alike.
Thanks, Doug. I have to smile on that one. Okay, Randy.
Yes.
Same question.
Yes, yes, I will agree with Dr. Lowry that
Lori.
being the importance of being aware of the background of providers and investigators is really important when we approach potential participants for research. Also, in the same line, I think that it's also important for investigators to also have sincerity and trust within that relationship as they engage participants. When one approaches participants for a clinical trial or research study, oftentimes the participants also are gauging the sincerity of the clinician or the investigators as well. So I think that also is important when we think about the how one approaches and the value of differences of an investigator and similarities of an investigator to the participant.
Thanks, Randy. Jeff?
I think one other layer I'd like to add here is that when you have a diverse group of researchers to draw on as you consider, both the planning and the implementation of a given research initiative, what you potentially are able to draw on are experiences of empathy, experiences of, identification, and experiences that confer understanding that might be very instrumental where the implementation process of research is concerned. That can work its way into a lot of different areas. It could work its way into question formation. Sometimes we get into this process, for example, that's called cognitive testing. We tend to assume that the way you pose a question is understood the same by all. But we've seen time and time again that, there is no such thing as universal interpretation. And when you have a diverse mix of scientists who can take a look at things like that, they may be able to upfront identify word choices, for example, that might be sources of confusion or be responded to differently by certain groups of people. They might also on the back end be able to tell you, okay, so what happened with these results here for this particular subset of persons? Because when placed in context, what might appear to be an aberration might actually make sense given the particular historical or current experiences of a given group. So that diversity potentially gives you not just, different perspectives to bring to bear in terms of just the quality of the research. It can really work its way into how is it that we actually, pursue this information that's so vital for us to make progress where health, gains are concerned with respect to how we invest in two specific research initiatives and projects.
Okay, so your responses to that question were right on target. So I'm going to ask you one more, which will be the last one. What do you think the challenges are for researchers and providers from minority populations to embark and stay in biomedical careers? What actions make a difference? Does it come down to funding, or are there less tangible steps we can all take to support a more inclusive culture in our fields and institutions? Okay, there were two questions. Would you prefer that I ask them individually?
Dr. Gray, I can take the part of the first one if you will allow me to.
Okay,
Okay. Well, so
Go
with this
ahead.
one, I would like to speak to the part about embarking. As I mentioned earlier, let's talk about the professional pipeline for just a second. And so we can talk about the situation of people who are already practicing professionals, but part of what we also have to attend to is how it is that we get people to be in position to provide the service that we're aiming for in the first place. And so there's a lot of research that, really calls attention to the fact that we have to be able to figure out not just how it is that we can support people once they're in the field, how do we actually increase the flow of people into those training and education and experiential programs that will help people to be built and to be, really given opportunities in ways and at levels that will allow them to offer the type of high quality and empathetic service that we're talking about. So we have to attend to things such as, the nature of the educational cycles that exist. So certain programs you can only be admitted once a year, and if you miss the deadline for being able to apply for that, you might be out of luck until the next year. People sometimes, when they have little resources, have to take jobs that may take them in completely different career directions when things like that happens. The training time that goes along with certain careers is also something to take into account. I remember when I was telling people that I was going to grad school and I was going for my PhD, they were like, dude, how much longer are you going to be in school? When are you going to really get to a place where you're making money? You got people in your family that would benefit from you working right now. You're going to go to school for how long? And, of course, we laugh and joke about that. But that whole idea of having additional study be something that you do, not just for yourself, but in mind of the resources that you or your family need, it's more than a notion for some folks. So we have to think about how it is that we can improve the pipeline process. In that pipeline process too, how do we put more mentors in place to be able to help people who are coming into spaces where they may be rare, be able to see examples of success so that they can figure out how to model that success and therefore increase their ability to proceed in a way that's going to be effective where their service is concerned.
Thanks, Jeff. Appreciate that.
Dr. Gray, I'd like
Jeff?
to add to that, if you don't mind.
Okay.
Yeah,
Thank you.
I think Dr. Hall is right on point, and I think too, when we talk about like the pipeline, we're talking about how to get people invested into some of the sciences. Even starting earlier than just going to the undergrad or high school, we're really thinking, maybe starting even elementary schools, and getting kids in understanding and invested in the value of science, the value of of interactions, letting them see individuals of color being part of having these leadership appointments in certain venues, so that they can see themselves like, oh, I can see myself in that type of position in the future, and really being engaging. I know when I was growing up, I didn't really see many people of color in leadership positions or seeing them within in science, but it wasn't until I got into the high school, middle school and high school is when I started seeing flavor of individuals say, oh, well, I can see myself there. But I thought that if it was done earlier, I may have had more drive to actually go into more of the sciences earlier age. So I think that's important to think about, how can we influence individuals even at an earlier age in some of these things, in these sciences, and let them see the variety and diversity that can be true. And then also in relation to the mentorship, I think that's truly a key where, we're having individuals really mentoring others to be in certain positions and being able to help support them along their journey within these sciences and within the research. And not only just mentorship, but also sponsorship. When one is in certain positions, being able to help guide them into other positions of leadership so that they can also continue that rotation of mentorship, leadership, and then again, move into a sponsorship role.
Okay, so Doug, when you respond, also think about, does it come down to funding for biomedical research?
Well, I do
Or
think
there-
so, Paulette. I think that for people who are independent researchers, funding is absolutely necessary for them to be able to conduct the research. But what I think that Jeff and Randy are talking about is really what is needed to be done up front before you get to that point where you are going to be applying for funding and things along those lines. What they have said is critically important. The way I think about it is that we need to create a system where underrepresented groups will not be seeing themselves as outsiders or as outliers. Instead, they need to see themselves as, yes, I'm part of this group. And to do that is not straightforward, as both Jeff and Randy have been saying. And there are many intangible aspects for that. One of the aspects that I think is really important is that people from underrepresented groups should be able to see other people like them that are engaged in doing the research. And that's not straightforward. But one of the things that NIH is doing is with the so-called FIRST Awards, which is an acronym, is to have cohorts of investigators from underrepresented groups who are working together at the same institution, which I think will end up being very constructive. There is no one factor or no one activity that is going to spell the difference. Instead, as I think both Jeff and Randy have emphasized, this needs to be a multi-pronged effort, and it needs to be an effort that is sustained for much longer than 1 or 2 years in order to be successful. But I am optimistic that because of the commitment that there now is on the part of so many people, that when we look back, say 5 to 10 years from now, we will be able to say it's not perfect, but it's much better than it was in 2022.
And I agree with all three of you. And I will simply state, that there are less tangible steps we can take to support a more inclusive culture in our fields and our institutions. And on that note, Doug, I will turn it over to you.
Well, Paulette, thanks so much for your questions. That's what we have time for today. And I want to thank all of you for spending time with us, and to thank our experts for sharing their stories, their expertise, and their advice. This brings us to the end of today's event. This video will appear on NCI's Facebook page, LinkedIn, Twitter, and YouTube channel. If you have further questions or need help finding cancer resources, please call our Cancer Information Service at 1-800-4-CANCER, that's 4-CANCER, or visit cancer.gov/contact for a live chat. Thank you all for tuning in today. We look forward to seeing you next time.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER.